welcome back. Thank you for doing that. I'll send out a new meeting invitation. I think we'll go ahead and get started. And if anybody else joins, we'll just let them in. Okay, so welcome everyone to our second meeting of the Healthy Housing Network Group. We're going to start with a just an introduction and roundtable. If you want to just say your name, and if you're affiliated with any specific organization, you can share that as well, or your interest. And then if there is anything that you would like to share in terms of healthy housing that you don't already see on the agenda, you can feel free. So my name is Andrea Orest, public health educator with Cook County. And all of the information that I'm going to share is on the agenda. So Karen, do you want to go next?
Okay, Karen Christensen. I am the new Cook County Veteran Service Officer, and I'm joining this group because there are a lot of our veterans who are in need of help in this area and other things. I just want to be connected to all the proper resources in order to help everybody else.
Perfect, thanks. Greg?
Greg Westigard, Schroeder resident, West End activist, very interested in connecting with all of this and possibly an example of the type of people we're trying to reach on this. So very interested in being involved in this and thinking how we can spread the word on this to the West End townships.
Perfect, thanks, Greg. Amy?
Hi, I'm Amy Rennie. I work for AEOA in the Two Harbors office, but I cover both Cook and Lake County. And I'm just grateful to be part of the group. I don't really have anything to add. Oh, by the way, I also use she, they pronouns.
Thank you. Martina?
Hi, I'm Martina Johnson. I'm a social worker supervisor at Cook County Public Health and Human Services. Very interested in this project because we have several clients who are in situations where it'd likely be considered unsafe. And it just is a great resource that we can have in our toolbox when communicating with our clients. So thanks.
Thanks. Grace?
Hi everyone, I'm Grace. I work with public health here in Cook County. Here to support the project as it gets off the ground and support Andrea and Andrea in going out and doing the housing assessments in the community. I'm also, Andrea, taking notes right now, just so you know. I've got that going on.
I appreciate it. Thank you.
Mm-hmm.
Welcome, Laura. Would you like to introduce yourself next?
Hi, I'm the new in-home support coordinator for Public Health and Human Services in Cook County.
Excellent. Thanks. Kat?
Hi, my name is Kat Mayo. I'm the Cook County Local Energy Project Executive Director, and we're a small nonprofit in Grand Marais. I'm really interested in this project and its success, and really curious to learn more about what's going on with people's heating in their homes in Cook County and the energy efficiency of homes, and seeing how we can help the community, get new installations and things like that moving forward to reduce emissions.
Excellent, thanks. Shane.
Hi, Shane Steele, Sustainability Coordinator for City of Grand Marais. And yeah, like Kat, City is interested in this project for energy efficiency and electrification possibilities.
Excellent, thanks. Jason?
Hello again, Jason Hale, the Executive Director of the HRA for Cook County, and I'm here because housing.
Good answer. Thanks. Andrea.
I'm Andrea Tofty. I work along Andrea and Grace on Public Health. Yep, and here to support our team.
Perfect, thanks. And it looks like Jody hopped off and maybe we'll hop back on. So let's see. So the next thing on the agenda is just if there was any additional thoughts on the current draft of the mission statement. I think I incorporated the input that we had, if anybody had any other additional input. Otherwise, we can work with this one for a while and see how it grows. Oh, and Laura, I don't know if you have an agenda. You don't. Oh, Martina, could you forward it over to her? Thank you. All right, perfect. So, Jason, I didn't give you much notice, but are you prepared to do a presentation, or should we save that for another time?
I just saw that I was on the agenda about 3 minutes ago.
Yeah, so was
but-
that enough time to put it together? 3 minutes?
Yeah, I know. I got it. Yeah. If you want to see it, I'll share my screen. I think I can share it here. Give me a second, and I will pull up the agenda, or the agenda. Sorry, while my brain's everywhere. I'm going to pull up the summer results. So we're not going to go through all of it, but you can definitely see the gist of what people are saying about rehab. If you'll let me know when you see it with a thumbs up or something.
Yep, I can see it.
Great. Thank you. Okay. So just quick context and reminder. Thank you, Andrea. This survey was done, the HRA did this over the summer, it ended at the end of August, and the intent was to understand what are the needs for rehab in the community and like how much, that's the scale of that, and then the types. So with the breadth of it, are they predominantly around envelope issues or their foundation issues, or just wanted to suss out a little bit what is the scope that we'd be working with. And just one more thing, we want to understand if there are existing programs that others offer, like AEOA or Minnesota Housing or something, that already address the lion's share of the needs, because we have no interest in reinventing the wheel. We'd rather tap other partners and resources and utilize what they have if they're a good fit. So that's the backdrop. So we had 79 responses. We had a few paper responses that were filled out manually, I suppose, or the old-fashioned way. And then I just added those in here. So they're all captured in the 79 here. One note, one thing we learned is that we had made them available at like the Hub and Clearview General Store and a couple of other places at one of the town halls. And we learned anyway that, because we want to make sure that people that didn't have access to the internet or aren't as comfortable using that in that space were able to access and fill it out. What we learned though is that you really have to speak loudly and often about where they are and that they're available, because there's like an initial, and this is not news probably, there's an initial press release about, hey, we're doing this thing, and then people respond, and then I kind of, because I have the dates of surveys, and then they just kind of drop. So I learning the hard way, just trying to help. If you ever want to do another survey, want to do paper copies, I would say right away they're available here, and hammer that drum. Okay, anyway, enough of that. Here's what we learned. Most of the people responded, of course, own. Of course, there were a couple here too, not a lot, but 1 and 2 that were contract for deed, living for free. I think they called it couch surfing, and then a couple of people who do not have a home. That was their responses. So with regard to where the distribution geographically, most people, unsurprisingly, were within city limits of Grand Marais. But there were people, several people in Colville area, or just outside of town, and then down from Lutzen. So it was spread across the county, but definitely concentrated in, let's say, the 5-mile radius around Grand Marais. We asked what kind of repairs they would need. And again, we excluded anything cosmetic. We weren't interested in providing, new paint necessarily, or new countertops, unless it was a health problem, I suppose. What we learned is all sorts of things. People need all sorts of help. Probably not surprising. So it ranges, but of course you can see here about 50% of the folks responded with envelope things like siding, windows and doors, and roofing. Those are the top three, which from a housing infrastructure perspective, those are the important ones to keep our housing living long enough to serve multiple generations. So I'm not surprised, but it's just a reminder that, oh, there are some more of the significant longevity issues are problems for folks, and not surprisingly, they tend to be the most expensive rather. So speaking of that, well, actually that's number 5, I think. We asked if they're planning on doing any of these, and this question, you can't see all of it. It might be easier to see this way. Can't afford it. 36% of folks said they'd like to fix some of those things, don't have the money. And I kind of view the only when I have to folks and the can't afford it is in a similar pool. If obviously they had extra income or means, they would probably do it and not wait for it to break. So there are, obviously you can see there are some folks who are planning on doing it. 26 of the respondents here said in the next few years, probably, in other words, probably not dire enough to have to do it tomorrow. What I thought was interesting is 5 people said no. And what I would have loved is if people expounded upon like, oh, why not? But there are several people who responded who were renters. So that's part of where those no's come from. They're not going to do it because it's not their property. So when we got to costs, this was surprising to me. Most of them were over the maximum amount, more than $25,000. But when you think about things like a roof or new siding and windows, that's not terribly surprising. A roof is north of $20,000. I just had to replace mine, and it was unfortunate. But those are the big ticket items, and probably, well, largely the reason they say that I can't afford it. I'd like to. The other thing is we have to keep in mind that this is self-reporting, and unless they have gone and got bids from contractors or something, they're kind of just assuming it's going to be a lot of money. And they're probably not wrong, but how much exactly, they may be maybe not exactly spot on with the true cost of things. So I'm always keeping that in mind when we're talking about actual like figures, like trying to put it in cost ranges. They may not, unless they're contractors or they've done work lately themselves or had somebody do it. They may not know exactly what those things really cost. But nevertheless, majority of them, just over 50%, said the highest cost amount. Planning to make any improvements that they identified. Oh, I think we already kind of touched on this one. Oh, yeah. So they were, whether or not they were planning on addressing it, this is more of the context for why. Again, can't afford to fix themselves because it's cost. A lot of them said can't find a contractor. So that's the other thing that I wanted to kind of, I don't know, maybe spot check, or I'm not surprised at all, but 2 things just quickly. 1, it's reality, of course. 2, it's also become so well established that you can't find a contractor that I would suspect that a lot of people haven't even tried. That they would say like, 1, I don't have a ton of money to do this. 2, who do I even call about doing this? Everybody's so busy. So, I'm not saying in this case, the perceptions is reality. They would have a tough time finding a contractor, especially if it's for a smaller scale project. So if you needed like 1 or 2 windows done, that's going to be a lot harder than saying, hey, I've got a $40,000 job for you. It's just a lot. I mean, maybe they could squeeze it in and between jobs or something, but unless it's a bigger ticket item or a lot more work, it's harder to find somebody. Nobody was waiting until they sold. And there were some other reasons here. We had 17 other responses. Again, not their own home, the rental. Those are the most that said no. They don't need repairs. It was interesting, and I'm not terribly surprised, I suppose, but the don't know where to start. To me, I mean, that's only 9 people, but to me, that's just simply an education opportunity. Like, hey, you need, and that's where I think some of the healthy homes assessment stuff that you're planning on doing will be a really nice tie-in. If people want to do that, then they do know where to start, and you can provide a sort of a roadmap and prioritization of the things that they need to do. So it's not a huge number, like I said, but it does confirm that some people just don't even know how to go about fixing these things. I'll send this out to people if they'd like it. I wanted to get at the loan conversation, like what the research from our HRA's perspective. Do you think it's a good idea for us to provide or connect you with loan resources? Again, most of them said no, they're not getting a loan because they either can't or do not want another payment. So of course, if you don't have the cash, a loan is the way you would go about fixing these things. And again, the lion's share of folks said no, they can't afford it. Some people are thinking about it, just haven't got around to it. They're not really. I'm always interested, like, if not, why not? If it's not because you can't get approved or you don't, can't afford the payment, maybe they just say, I don't really think about fixing these things, or I'm not thinking about it. They're just generally not thinking about it. But then again, this is like kind of plugging that in their brain. Maybe there are opportunities to get some of these things taken care of. I haven't really thought about getting a loan. Almost done here, I promise. This was added a little bit later in the survey after someone made the recommendation. And it was a good recommendation, so we put it in. So only 52 of the 79 answered because we had a kind of the first bout without it. But you can see this kind of surprised me, actually. I thought there would be more people on the lower income spectrum. Most of the folks that responded were above $50,000 a year. The affordability piece I thought was particularly interesting, considering that. I would have suspected it would have been people on lower fixed incomes that had that there would be a more direct correlation between incomes and desire to get into a loan or ability to. This was just about whether or not they thought it would be helpful for the HRA to provide a program. Most people said yes or maybe, just depends on the details, which is not surprising. They'd have to know what it is. Some people, and they left comments here too, and I can send that. That's number 10 here, is why or why not. And I'm happy to send. There was some very interesting feedback, I'm sure you can imagine. Yeah, and then the last thing is that I have 24 people who would be interested. So as Healthy Homes get rolled out, and I sent this to Andrea, as that program or as the county's working with folks on available resources, we have a list of 24 folks who'd be interested in learning more. So it's not a ton, but it is some. And I'll stop shorting that. That's the gist of the survey. There's 154 pages of data for if you want to see all of because it goes over every person's response and all of the. So I'm not going to send that. I can send you the summary if you want that. Happy to do that. Just let me know.
Excellent. Well, thanks for that wonderful last minute presentation. I appreciate it. Welcome, Anne, and welcome back, Jody. If you would like to introduce yourselves, we can jump back to that for a minute and just introduce yourselves.
Sure. Ann Sullivan, Cook County Commissioner for District 4. And I am also sitting on the CCLEP board, have been very interested in affordable housing, being part of the HRA and also the workforce housing group that preceded that.
And I'm Jody Trevor Roberts. Thanks for letting me jump back in. My computer decided to restart during the thing. So I am the early childhood navigator at Sawtooth Mountain Clinic, and housing is one of the challenges that families that we serve have. So I'm just interested in learning about this project and kind of keeping my ear on the housing conversation.
Perfect, thanks. Okay, so does anybody have any questions for Jason at all about the presentation or the data or information?
Jason, I have a question.
Oh. Go ahead, Ann.
Okay.
So one of the things, and perhaps this was answered prior to my arrival on the meeting, so I apologize if you've already addressed that, but I'm curious if there was a question in the survey about household income and what percentage of household income people are paying.
Percentage they're paying?
Yeah, so like for their housing, whether it be rent or a mortgage.
Oh, I see.
What percent of their household income are they paying? Because I wonder if it's like 50%, then that might explain why they're in a higher income bracket but can't deal with a loan. Just a thought I had.
Sure. Yeah. So basically, how many people are cost burdened is kind of what you're doing. Yeah. So we didn't ask that question. We did ask for incomes, and I did was explaining to the rest of the group that most of them were over 50,000 a year, which was surprising to me because there were more people earning above 50,000 than there were people. I should say, let me flip that around. There were a lot of people saying that they wouldn't get a loan or they haven't fixed the problems because they don't have the funds. And I thought there would be a tighter correlation with that and people earning below $50,000. So I was just surprised at the level of incomes considering the need. And the one thing is you have to mine through all the data. So the summary doesn't capture like how many people are, let's say that somebody had said that they make $100,000 or more a year, for example. But they also said, like the summary doesn't capture whether that person said they can or cannot afford a new loan. So I have to go back and look at every individual response and see where that correlation is. Of course, you suspect the lower the income, the higher the likelihood they can't afford it. But we do have cost burden information though from Deed and other sources. So we have a countywide, we have a general idea, but we definitely could have asked that. It wasn't included. Sorry, Ann. Grace had a question, I think, or did you get it answered?
Well, it's sort of related, but I'm gonna share my screen because I'm one of my favorite sites. I'll put it in the chat box too. Is Minnesota Compass, and it's demographic data by county. So this is. Are you seeing it now? Yeah. So here's the county-wide income distribution. And I'm wondering how it correlates with the survey respondent income distribution. I feel like the survey respondent distribution, like just my memory from the last 5 minutes, is skewed slightly higher. Because there is like almost a quarter of the folks living under 35,000 a year. But I mean, there's also more than half of people in the county living above 50,000. So I don't know. Just curious if there's like a segment of the population that the survey might have missed that's living in this lower income bracket.
I'm pulling it back. I exited out foolishly. I'm pulling it right back up. Just a second, Grace. Sorry. Because I think it's close. The distribution's close. Okay. Well, and here's another question. I have, is yours household or individual incomes?
Household.
Okay. Yeah. 13, 30, 40, 42 of 52 said their household income was between 50 and or above $50,000 that responded to this. And 27 people skipped it. So we're not capturing everybody. To your point though, on here we have 7, 8, 10 people of the 52 who answered were under $50,000 a year. So we didn't get the same income distribution as what you're getting at. It's not reflective of necessarily the county unless the people who didn't want to answer had lower incomes. Then that would make some of the difference there.
I think it's still valuable data. I'm just kind of curious about those folks that like maybe it would make sense to me that people who are maybe in a higher income bracket chose to answer an online survey. And then,
yeah, agreed. And that's part of the reason we try to put it at the hub and we put it at the general store.
I mean, it's a hard thing to try to get at like actual representative samples of who's, answering a survey. But yeah, it makes me think so.
One other thing, just quick, it's a great point, Trace. And one other thing the things noteworthy is typically renters are definitely less likely to respond. And typically renters, the distribution of homeownership and renters is definitely skewed towards lower income renters. So the population in Cook County, if most of the renters are below 50,000, they're much less likely to respond to a home rehab survey because they don't care because it's not their property, or they don't care as much perhaps.
Right.
So that's part of the problem. We might be not capturing them because they don't own the property and they're not going to respond anyway.
And also I'm wondering if, the resources that might be available in the forms of grants or financial assistance would probably be targeted more to the households under $50,000 a year. So the group that you got answers from, I mean, maybe asking about the HRA loan option is something that would be more feasible for the people who responded to the survey and are at a higher income.
Yeah. Greg, did you have a question?
Yes. You said a little while ago, one of the things is to keep houses living long enough to serve the next future generations. And we need to reach fixed income seniors who are the lower income bracket that you are underrepresented. We have, and the people that were doing our housing survey could well be the people in fixed incomes who have houses that are going to be turning over soon, because my house is going to turn over a lot sooner than a lot of you because of my age. How we can work that, I'm thinking, and I always think, being a West Ender, possibly going to something like the Wednesday meal at the in Tofty, and reaching out to our people, because we really, if we find people through our healthy housing survey that need this, but can't do it or look at how their finances are because they're fixed income, debt free, we have to do, among other things, helping people look at how keeping their house going, because a house is an asset to our community, like our land is. I see lots of opportunities to look at this. I'm on the Soil and Water Board, and I look at how we preserve our other features. Well, I think that preserving our housing is like preserving our land. So a lot of things there, but I see a lot of opportunities here to look at reaching the group that we're doing our housing survey, to look at the health of their houses as well as their own health.
I just want to respond quick to I'll try to be as quick as possible, Greg. Those are great points, and I totally appreciate that perspective. It's a bit of a double-edged sword, and the reason I say that is because we want to improve the structural integrity, longevity of the home, the stock that we have in Cook County already. Like that is the fastest way to build a house. I've said many times, is to keep it from going down. The quickest way to gain a unit is to keep you from losing a unit. So we as a community should have a definite interest in trying to make sure that our housing stock stays viable, our existing stock. Having said that, one of the natural orders of things with housing is typically that folks who are, as folks age and they either move out of their existing home because they want to downsize, or they move because they retire somewhere else, or they want to, if they can't age in place anymore. That's a common phrase now, where basically people bring services to their home and they're able to stay in their home as long as possible. The point is, once that ends, and that our aging population leaves the home, whether they sell it or move into an apartment that's available, etc. The goal is, I think Greg's gone. That's okay.
I'll
The reason
watch for him to come back on.
What's that?
I'll watch for him to come
Okay.
back on.
I'll finish my quick diatribe and then I can connect with him afterwards. The point is, oh, here he is. There you are, Greg. The point is that if we improve all of those houses that need improvements, it almost automatically bumps them up in the price bracket, which means they're less attainable for younger folks and families who could afford maybe a house that needs some improvements. I know it seems counterintuitive, but as soon as we start fixing them, they become a costlier house to purchase. Whereas I can attest, my first house needed a lot of work, and thank God, because I could afford to buy it and improve it over time. And younger people with families may be okay with buying a completely outdated house that needs a new roof or something like that, because they can incrementally improve it as time and resources become available. But it sounds kind of backwards, but if we improve everything, then we're the entry-level homes that have room for equity, because they need the work to be done on them. That's part of the problem with having too good of a housing stock. And I know that sounds crazy, but I look at all of what we have as an opportunity. And when I think about improving homes for folks on fixed incomes, I'm particularly concerned about people who want to stay and age in place and to have homes that are, if they're committed to staying there for the long term, helping to ensure those homes are habitable and envelopes are solid and this, infrastructure is good. But as people decide to sell, it's actually an asset to have homes that need work because the price point is lower. That's all.
That was helpful. Thanks. Oh, Greg, you're on mute.
It's very, couples our age say, it's what do we do? How much do we preserve the house? How do we do it? What do we need at a certain point when we can't be here? But possibly we can be here until we're in our 90s or so. You never know when you're an older, healthy couple. It's very complex, and and yet you really want to have the house not deteriorate because you can't necessarily do it. So good answer, Jason, and very interesting in how we look at this, because we wear a lot of different hats.
Greg, I have a quick question for you. The Wednesday meal in Tofty, can you give me some quick information about that?
Well, we have we have the senior meal at the school every
okay.
Wednesday, and that's a good way to meet the audience that we're looking at.
So at Birch Grove.
Yes.
Perfect.
And just to go
Thank
down there,
you.
I'd also be interested, wearing my different hats, to go to the 3 township meetings, just to say, this is what's happening out in Schroeder, Tofty, Lutsen. These are some of the things that you know about. Of course, the township meetings are basically the township board, and I know all of our Schroeder Township board people, but it's a way to get our different programs out more and to let the townships know what all is going on beyond our west end.
Yeah, that's great. Thanks. Perfect. Any other questions or comments for Jason? And I promise we're going to end on time today. All right, so the next item on the agenda is the update on assessments and the process for the healthy housing assessment. So today is the technical go live date for our department going out to do assessments. I have not scheduled any yet because today is the go live date. I have 5 people on the list, either from individual requests or referrals. So I will start with those 5 people. And after the meeting, I'm going to email our, we have like a healthy housing flyer, sort of an information sheet. I'll email it out to the group so you can, share it in your networks. So hopefully by our next meeting, I will have lots of input on how the assessments are going. And I made a note here to take special notes or specific notes on heating and energy efficiency information. So that way, if there is information to share specifically with Kat and Shane, then, I'll have that. Do you have any questions about that? Because that's all I have to share is yay today.
I just want to say thank you, and thanks you, Andrea, for all the work behind the scenes that you've done to get the assessment tool ready and to get everything up and running. It's really exciting that we're at the go live date today. So thanks for all your work.
Yeah.
I'm really looking forward to, next month you'll have some, assessments under your belt, and you'll have some news on how things have been going to bring back to the group. I think that's just really great. So thanks for all your work so far.
Yeah, thank you. And thanks, Andrea. I'm really excited I'm excited for the go live day. I feel like I've been working and working and working, but today is the day. All right, so the next agenda item is begin the creation of the local service map of housing resources. So, we have 20 minutes left, and I guess, maybe we can start by a conversation of like what we would like that process to look like. As like the process of creating that service map to look like. I've participated in a few different service mapping projects, and sometimes they go really smoothly and sometimes they just derail rather rapidly. So, as someone who does not know a lot of housing, my initial thought was, to sort of divide it up into different areas of home repair and upkeep, but maybe, I don't know if Jason or Kat or Amy or anyone else, Greg always has good ideas. If anybody else has any suggestions about where, like what sort of, what's the word I'm looking for? Like topic areas the resource map would be divided into? Really smart thoughts on that?
Are you talking about repairs, Andrea? So like general contractor, and then get into more specific like electricians, plumbers?
Yeah, I think that that's valuable, but I can probably pull that together all on my own. I'm mostly, I guess maybe I'm thinking more like, programs that might be available to people, like programs that AEOA has, or programs that, if there are loans or grants or other resources for people to use. I don't know. Am I describing it right?
Yeah, I think so. Like grants, financial assistance, whether there's a program that can provide a specific item, like, I don't know, maybe someone gives away a bunch of fire extinguishers or something like that, and we could tap into other resources because, we have a finite grants. And of course, we'll keep looking for other opportunities and apply for more, but we want to maximize the resources that are out there and available to people. And it's a hard thing to pull together. And maybe there's something specific to veterans, for example. And if there is, we want to make sure we're letting people know about that. So that, I think is that what you're trying to say, Andrea? That's how
I think so. Yeah, I think so. I think, to relate back to the survey results that Jason shared, those people who just don't know where to start, like, coupled, not all of those people are going to have a healthy homes assessment, but if we have a resource compilation of these are grants that are available, these are, loans that might be available, or sometimes fire departments give out free smoke alarms, or, whatever churches give stuff out. I don't know.
I can think of a few buckets. And Grace was touching on this too, because you're kind of looking for umbrellas for these, right? Like, how do you categorize the different resources? Like one intuitive one seems to be, speaking to it, health and safety, which that could be anything from smoke alarms to lead in the water, or lead paints to, could be electrical knob and tube wiring or something. Like there could be grants and resources that the state comes up with, or other entities that are explicitly about making sure homes are safer. Then you could do rehab resources, which often there might be small grant components of those, but they often might be long-term loans or favorable loan terms and deferred loans, no payments, that sort of thing. And then maybe you have like special loans or special resources that are like targeting certain populations. So maybe it's veterans, or maybe it's folks that are like, it's very income qualified or something. Like, there might be specific types of programs that are targeting specific users or applicants. So those are 3 or 4 different kinds of buckets I could think of. And then of course, under each of those, there's going to be little subcategories, but those are the larger ones.
Right. See, that's what I was thinking. Thanks.
And so, Andrea, thinking of that safety bucket, the county provides free radon tests. They've got hundreds of them in land services. So that would be something to put on that list, because many people may be unaware of that.
Right. I don't know why I'm frantically writing this stuff down. As
I'm
Grace is
writing, I
taking
got
really
it. Don't
epic
worry.
notes. Have it. Greg?
Of course,
was
it's not
look-
directly
Oh,
related, but there's right now, AEOA is starting the big energy assistance applications. So that's, again, it's not directly related to what we're talking about. AEOA tends to also label their resources towards like weatherization. So that's an area if people are specifically looking, you know, that includes things like windows and doors, and that's not part of the program. I would be more rental assistance. But this, what you're doing for me is giving me the, providing me the reason I need to go through my AEO website and see what we actually do and who actually does it so that I can help this group with some of the resources from my agency.
yeah, that would be great. Thanks, Amy. Greg?
One of the resources that we could tie into is the property owner's resource guide that is put out by Planning and Zoning Department, which is a good starting point to interconnect with that, because that guide has pages about many of these things we've talked about. We want to interconnect and work with as many groups as possible. None of us are going to survive unless we coordinate with the other people. So this guide should be part of the conversation.
Yeah, that is a really great guide, actually. I have a handful of them, or I have a stack of them that I will be able to give out to people who receive the assessment, but making people aware that that resource is available is great. Yeah.
And there
And
is also an
let planning
electronic
and zoning
version.
know that we're doing this.
Yeah.
Do you have the electronic version, Andrea?
No, I don't actually.
So that's on the website and can
Oh.
be downloaded. So that would be another thing for people that don't need the hard copy.
Yeah, thanks.
It's called a property owning handbook. Is that what that was called?
Yeah, the property owner's resource guide,
Okay.
a reference guide to Cook County land use, and is published by the Planning and Zoning Department.
Okay.
And they have a number of them just on the wall outside their office, right across from the soil and water office.
And both
Excellent guide.
Neva and Diana Lindquist have boxes of them. So
Oh, great.
available.
I need to get my hands on some of them. Okay.
Excellent, thanks. Martina put a comment about if we're talking about making homes livable for as long as possible, it might be worthwhile to add this information, access north ramp project. So I'll look into what that is, unless Martina, if you're available to talk
Yeah,
about
I
it at
can
all.
just say it gives some instructions if you want for a homeowner to build their own ramp. Also, there are funds available that people can apply for help with building a ramp. So it's actually a program that people can look into. There's a access coordinator on that site that they can contact if they want to learn more. But this is something that we see people needing as they age in their homes.
That's great, thanks. Okay, so we have 10 minutes left. So we sort of have a list of umbrella items.
Mm-hmm.
And then some resources that could go under those umbrella items. So when in preparation for the next meeting, I will take those umbrella items and the information that we've already shared and make sure that I have that in a readable document. And we can keep adding to it and working on it as we go. Grace? You're on mute. There you
Question
go.
for mostly Amy probably, but maybe also Shane or Kat. So what's out there in terms of like weatherization support? Like if there's a home that either needs like appliance upgrades or I don't know, maybe it has like window issues. Like I think that's an AEOA program. I just am not very familiar with what it all entails. And maybe that could be like a separate email if I'm getting us off down a rabbit hole. I'm just kind of curious how to put that in here.
This is Amy, and interestingly, the housing program I work with doesn't include the weatherization program. So I promise, it gives me inspiration to continue to seek the resources that my own agency offers. So I will look for information about weatherization, anything that relates to it, and then make sure that we've got information about energy assistance for our folks too, from AEOA specifically, and then anything else I come up in that area around that topic.
Great, thank you, Amy.
Andrea, that was one other bucket, sorry, that and you probably already have it, but I forgot to include is probably its own separate bucket is energy efficiency and sustainability, because there are specific resources in that track.
Yeah,
Yeah.
thanks.
I think that would be great as its own umbrella itself. And I personally have many resources I could send your way to add to that list.
Perfect.
Like in the means of like guides or handbooks for people to look through, or for like new incentives with the Inflation Reduction Act that came through, like the Rewiring America calculator for homeowners or renters to utilize, things like that. I can send to you.
Yeah, send all of those things. That's great.
Yeah.
It looks like Jody hopped off, but I saw she put a comment in the chat on AEOA weatherization rep in Grand Portage, or maybe she just does energy assistance. Is anybody familiar with that?
I think AEOA, I mean, again, I should know more, but my sense is that AEOA has pulled back a lot of human resources from some of the offices outside of Virginia and Hibbing. So I'm not aware that there's anyone doing any kind of housing stuff but me in Lake and Cook. But again, my program doesn't include weatherization. So I will make sure and look into who else might be doing anything, and then make sure that I'm up to speed on the things that I need to know to be able to help the group and the community members who need our help.
Yeah, that's my understanding is AEOA has the energy assistance program and the weatherization assistance program. And I think we're only 2%, like Cook County is 2% of maybe your, like who you service. So I don't think hasn't been serviced very frequently. I don't think Cook County is very high on the priority list since we're also so far away. And with many contractors being limited with their time and less people working, I think it's been harder for Cook County to generally be serviced with AEOA. And someone can correct me if I'm wrong, but that's at least what I've experienced this far with folks wanting help from them.
Thanks. Yeah, I'm not overly familiar, so thanks.
We should also connect back up. I know Jackie Kozlowski was on the first meeting, but
Yep.
it's good to see if there's any specific resources for Grand Portage that they might know about. So
Yeah, will you put that on? Andrea will do this in the notes.
I will.
Yeah. Perfect. Yeah, she did respond that that this time worked for the most part, but obviously it doesn't work all the time for everyone. So yeah. Let's see, any last thoughts on the service mapping? And I'll turn it into a magical first shot at a service map, and we'll just keep building it.
I don't know if it would be worthwhile or not, because it seems like a lot of the folks that responded to the survey were homeowners, but I don't know if there's certain resources that we should have categorically for like homeowners and renters, or like one side is for renters specific, to forward to their landlords, or I don't know. I don't know if that's
Yeah.
worthwhile or not, but just a thought.
I like that.
A good idea, Kat, because with the AEOA energy assistance, renters are eligible for that in many cases. So it'd be really nice to have at least a few resources that we could give to renters.
Yeah, perfect.
The other just quick note is that most of the, with the exception of rental assistance or like energy assistance, like Martina was talking about, almost all programs that are investing in the property are geared toward property owners. And so I think the advantage is to make sure that we include renters so that they can give it to their property owners or their landlord managers, to know that there are improvements. That was one of the challenges we had in Duluth, was letting landlords know that, no, you're eligible for this program too. If you're an owner of an apartment, for example, you should take advantage of it, because then obviously the tenants benefit from it too. So most programs are not designed to help renters, especially for structure, which makes sense. It's in, improving the structure of the building, whatever. But if there's a way to help raise awareness among renters locally, that's one other way to get to the property owners.
Right. Yeah, I like that. And part of, I guess, so my intention with the assessment is for renters would be that we do the assessment and walk through, and then, as long as they give their permission, then, we can connect with their landlord with the information, and or vice versa. Yeah, I'm not sure, but take the information and make sure that the landlords have it as well. So that way, if there are things, that are sort of, that low hanging fruit that they can take care of, or if there are resources that they're not aware of that could help with some of those things, then we can provide that too. All right, perfect. Well, see, we're going to end on time. Any last minute suggestions or thoughts or closings? All right, perfect. So I'm going to send out the Healthy Homes brochure to the group, and feel free to share it around. And I will get that service map started. My intention for next month is to have a hybrid option, so we can have an in-person meeting place and a Zoom, because there are a couple of people who don't Zoom, so the accessibility is a little bit less for them. But I haven't solidified the location yet. I was saying earlier, I'm hoping for the community center, because that seems to work for our community center board meetings. So I will make sure to, thanks, Jason. I will make sure to get that information out as soon as possible so everyone can plan. Okay, thank you all very much. I appreciate it. This has been great.
Thank you so much.
Thank you.
Have a good day.
Bye.